Welcome everyone. Today I am about to be joined live by Dr. Shiv from the Clinic to talk all about metabolic health, how that can impact your overall well-being as well as of course your fertility. So she should be here any second. Please do have your questions ready and we can get started. Hi to those who are joining, welcoming Dr. Shiv in a minute to talk about metabolic health and how it impacts fertility. So please have your questions ready as we begin. You sent in some great questions, so we're excited to get going with those once she joins. Just see where she is. And we can get started. Just connecting now. Hello, welcome to the Shiv. Lovely to meet you.
Hi, nice to meet you. Thank you for having me.
Of course. So I've given a brief introduction about metabolic health, what we're going to be talking about today, to do with hormones, how that impacts, well, how the lifestyle impacts your hormonal balances, and of course, fertility. So if you could please start by introducing yourself, tell us a bit about your background, and of course, the Clinic.
Okay, lovely. Thank you again for having me. I'm Dr. Shiv. I'm a GP specialist at the Clinic. And my special interests are in metabolic health, hormone health, and lifestyle medicine. And what we focus on at the Clinic is very personalised care. I use the knowledge basis from these areas of medicine to really help my clients look at the root causes of their problems, and then to look at how we can create personalised solutions that are not just about a medical prescription, but also about a lifestyle.
Fantastic. And we've had some great questions come in from our community that I'm going to be asking you a bit about today.
Brilliant.
So, first of all, what could you explain? What is metabolic health and why should someone think about it for their general well-being, but also for their hormones and how that might impact their fertility?
It's a really good question. So, metabolic health focuses on the key systems that affect our metabolism. And our metabolism is very simply how the body makes energy from the food we eat, and then how we utilize that energy to support the functions, the vital functions in our body. Our hormones are very closely linked because actually the hormones are a complex signaling system in the body. And they are responsible for regulating those vital functions that the metabolism is fueling. I think of the body as being a little bit like an orchestra. We are the conductors, and the different sections are made up by your metabolic health, your hormone health, your gut health. That's important too.
Yep.
And when all of the systems are in harmony together, you've got this beautiful symphony. But when one is a bit out of tune, then the whole piece can go wrong. And so, in that sense, when you have a dysfunctional metabolism, it's often underlying the underlying issue for hormone imbalance, and vice versa. Hormone imbalance, therefore, can underlie metabolic issues.
Gosh, so there are many layers to it, which we're going to unpack a bit today.
Yeah.
In terms of hormonal balance, from a lifestyle medicine lens, what does that look like in real life? And are there signs that someone's system might be out of sync? And also, how does this differ between women and men?
Yep. So from thinking of this in terms of balance, I always talk about the systems because they are so interconnected. It's really important to try and achieve balance in each of these systems. And I don't really think it's just about sort of your hormones being within a normal range when you have a blood test. It's about connecting with how you feel and whether things feel in sync. So lifestyle medicine comes into play here. The definition of it is that it's a medical approach to that's focused on treating, preventing, and reversing chronic illness, looking at root causes and applying what they call the 6 key pillars of lifestyle medicine. So that is stress, diet, sleep, exercise, social connection, and reducing harmful substances. So, and I think when we're thinking of this from a hormone perspective, it's really key to actually work on these six key pillars in order to achieve balance, but in all of these areas of our health.
Absolutely. And it's stressful in itself, isn't it? Worrying
It
that you are
is.
too stressed. And then obviously that can have a knock-on effect to sleep and vice versa. So these things obviously are very interlinked. And as you said, if one thing's off kilter, then it can mess up everything.
Absolutely. Yeah.
And obviously, if you're trying to conceive, you're heightened to this because you want your body to be in the best shape it can be to conceive.
And it's so difficult with conception because actually we start to worry about, are these things right? Is my blood level right? Is this right? But actually, what we've got to often do is look at those sort of internal stress levels. Are there things that we can do to optimize those and reduce them to help our hormones, to balance those hormones and make conception a bit more likely?
Absolutely. And you see a lot of people at the U Clinic who come to you wanting to find out more about their hormonal balances.
So yes, I think it's one of my key areas that I've helped a lot of. It's mainly women. I do help men as well. And you asked me, sorry, I didn't actually answer the question. Is the difference between men and
Hmm.
women? Is there much difference? The early symptoms of hormone imbalance and metabolic imbalance are very similar.
Right.
And they're very similar for men and women. So that's low energy, fatigue, weight gain, poor sleep, poor concentration. And so it can apply to both genders. And in the clinic, actually, that's generally what I get a lot of people coming in to see me about is low energy or concerns about their weight or how they're feeling, and whether their hormones are influencing that.
Because, of course, also lack of sleep then impacts your food decision choices as well, and how you're feeling in the day and energy levels, which is also impacted by food. So I'm not surprised. And do you often find that people come to you because they've started to experience these symptoms, or are people sort of trying to look at their overall general health to optimize how they're feeling? Like, are there normally symptoms that they come with?
Yes. So actually, as I said, the commonest symptoms that I get are that people come to me with are around those very vague symptoms. So excess fatigue, poor concentration, and weight gain, and generally a sort of a subtle feeling of just things have changed and things don't feel right. That's another common one that people come to me for. And it's where sort of it's quite difficult when you go to your routine doctor to be able to have the time to explore those concerns where they're so vague and there's so many things that can underlie those symptoms. And so yes, that's often what people come in with is that there are these niggling symptoms that they just can't quite get on top of, and that's where we help.
Yeah, amazing, amazing. And in terms of insulin resistance, especially with infertility, and PCOS, of course, what other subtle signs might people have which suggest that blood sugar or metabolic function needs looking at?
That's a really good question. If I may just actually explain insulin
Yeah, please
resistance,
do. Let's go back a step and do that first.
because actually that will help to sort
Yeah,
of piece it
definitely.
together. Um, when we think of insulin resistance, it's coming down to our glucose metabolism. Glucose is one of the biggest fuels. It is the biggest fuel for the cells in our body, and insulin is the hormone that carries glucose from our bloodstream into those cells. So when our cells get a bit overloaded or they're full, they've got more than they need in terms of to make energy. They don't they're not using it enough, they shut their doors to insulin and glucose. So you quite often see subtle signs before you would see a rise in your blood sugar. So the point at which you've got a rise in your blood sugar, actually it's fairly late in the journey of insulin resistance. Some of the first cells to shut their doors are your muscle cells. So you will often feel fatigue as one of the first symptoms, and lethargy and weakness.
Right.
One of the next sort of very glucose hungry organs in the body is your liver. But once it's full and once its storage capacity is full, it sort of shuts down. And then we kind of get this disruption in glucose metabolism. We get this disruption in fat metabolism as well. So we start to gain weight, change shape, and we start to put fat on our organs, which majorly disrupts metabolism in the body. And then the third organ that's quite hungry for glucose is your brain. So once you've shut the brain, once the brain cells have sort of shut themselves to glucose, you quite often get this mal-signaling. So early symptoms of insulin resistance can be cravings and feeling hungry all the time. So once again, very sort of vague symptoms, but the point at which you have diabetes or pre-diabetes is really quite late on in this journey. So I think when we're thinking of this, and in terms of PCOS or infertility, the insulin itself, so raised insulin in the body, causes a disruption to our sex hormone production. So actually we get an increase in testosterone production and decrease in progesterone, estrogen. So it can really sort of affect our periods, our cycle, our fertility. But the sort of managing this starts much earlier than that chronic rise. It's actually spikes and dips. So if we're having sort of really big sugar bursts at regular intervals, we're starting to create these changes in the system, in the body, that leads to the sort of the symptoms of insulin resistance.
Interesting. So do you see many people who might be struggling with PCOS, for example?
I've seen a few, I've seen a few people in relation to PCOS, but actually it has generally been it's not just PCOS. It might be that there have been either concerns around fertility, concerns around perimenopause, menopause, and young girls that are sort of just struggling with their sort of periods and balance, really. So, yeah.
Really useful to know. And then what about for people who feel they need attention, but they haven't had a diagnosis yet? What would your message to them be?
Yeah, so I think we might be the service for you. So one of our key sort of fundamental principles at the U Clinic is that we do take time with our clients. So I take time to listen and work with our clients to look at these root causes. And then we can look at investigations. It might be a detailed blood analysis. We've got access to sort of various forms of technology. So quite often we've used continuous glucose monitors to help us with people when we're looking at metabolism in particular. And then creating that health plan is so much about understanding your client. So it isn't, I hate the word prescription because I don't really think of it as that. I think of it as a joint plan and our clients are going on this journey, and then they can come to us at any point on that journey for support or coaching.
Amazing. Amazing. And that's something that the U Clinic shines at, is this personalized approach. So I want to hear a little bit more about personalized plans. Could you let us know how you do this case by case, spending this time to understand people's needs and where their focuses need to be, and for their bespoke care, I guess. Where for someone who's struggling, for example, with irregular cycles or
Yes.
fatigue, but hasn't had any luck with conventional solutions, what would you do?
So I think one of the things, as I said, is the first thing, the initial consultation is about getting to know that person, looking at them and listening to them and their full medical history. Because, and when we're looking at their medical history, we're looking at their lifestyle history as well. So I go back through childhood, so sort of detailing periods, cycle changes, but also other illnesses that might have, if they've had to have recurrent courses of antibiotics at certain times, if they've been under stress, if there've been any life events. So we kind of really look into the detail of their medical and their lifestyle history. Then we will establish whether we need to do any testing, because we work with biomarkers at the U Clinic. So we will look at what the levels are now, what we might be trying to achieve, if there is any imbalance. And as I said, the imbalance, that sort of what's within the normal range of laboratory markers, we're not always looking at that. Sometimes we're looking at if people are on the borderline, if it's not matching with what their history is. So we really look at it in a personal with a personal approach. And then in terms of that plan, it may involve a prescription, a medical prescription, and that's pending the situation. So it does depend on what we find and sort of what comes up as to what may be beneficial. So for someone with PCOS, for example, we would discuss and explore medications like metformin, if we're looking or working with insulin resistance and a lot of it, and issues around weight gain and worsening PCOS as a result of it. I can support with that. I can support with a weight loss journey. So we do look at a medical prescription if it's necessary. But our real sort of, the thing that we like to focus on the most is a lifestyle prescription. And I think one of the unique things at you is that we work collaboratively as a team. So I actually work very closely with the U Clinic's nutritional therapist. Her name's Kat Bright. She's wonderful. And we work together to sort of look at biomarkers, optimize a nutrition plan. When we're exploring exercise with patients, we really understand what their baseline is, where they want to go from there, what we're trying to achieve. And as I said, that approach, but to all 6 pillars of,
Fantastic.
the lifestyle medicine.
Yeah, well, it speaks to so many. And for people interested, tell us more about where you're located.
Okay, thank you. We're based in Oxford in Surrey, and we're soon to be opening our second clinic in Sevenoaks in Kent.
Congratulations. When's that
Thank you.
happening?
And we're hoping in the summer, in the next month, we're hoping
Fantastic.
just
Okay,
final bits
great.
of building work.
Great, brilliant stuff.
Yeah.
And then just going back to stress, because we all feel it, especially in the throes of fertility. Chronic stress, low grade stress. In the hormone and metabolic picture, how can you help clients tackle the stress?
I mean, I think stress is so important, and it's really that notorious hidden culprit because we can quite often sort of find ways to say, no, we're not stressed, we're just juggling.
Yeah,
That's one of
yeah,
my
exactly.
favorite words,
Exactly.
particularly as a mum,
Uh-huh.
or as a sort of young woman that might be, juggling
Yeah,
many
yeah.
things in their life. It's often another word for there is a chronic stress that's happening there. With stress, what we know is that it definitely influences metabolism, but also influences hormones, in particular progesterone, which is, I think, a really sort of sort of
Discuss. Yeah,
under
yeah,
discussed hormone. The focus
yeah.
is always on estrogen
It
and not
is, it
enough on
is. Yeah.
progesterone. And so when our cortisol levels are chronically high, the body wants to focus on making cortisol, so it actually reduces the production of progesterone.
Yeah.
And particularly at certain times of our cycle, if we've not got that progesterone rise, we lose that calming phase of our cycle. So we can become more anxious, mood swings, mood changes. you get the irregularities in your cycle. If you don't get the rise, you don't get the fall, and you don't necessarily get the bleed. There's elements of that it influences
Yeah.
irregularity, it influences fertility.
Mhm.
So when we're looking at managing stress, it's one of the key areas that we focus on. We normally will look at root causes of those stresses. So again, exploring in that initial assessment with our clients, we really take time to explore, what could be underlying the stresses or the cortisol.
Okay.
And then following that, again, it's applying simple tips and tricks that would be something that client felt that they could do. I don't think it's any good, and I think it can actually worsen stress levels if I sort of said, I think you should go and do some
Yeah.
yoga or
Yeah.
do some meditation, and that person sort of shoots me a look of absolutely, I can't meditate, so don't tell me to do that. So it's
Mm.
about we will work out together simple things that might help that person. It could be journaling, it could be walking outside in nature, it could be doing something that makes them laugh, because
Yeah.
actually laughter definitely reduces cortisol. So
Yeah,
that's the
absolutely.
sort of, yeah, that
Good
that would
to know
be our
about.
approach.
Yeah, and I hear you about the juggling part. And also when someone says, you know, do this or put this into your routine and you think, I don't have time, but you're right, you almost need to take a step back and then work out priorities to put your goals, to get to your goals by putting a plan in motion with an expert like yourself, to have you, on the right foot forward. And then in terms of movement and exercise, that's another big factor that you've touched on. Can you explain how that has such an impact in your hormonal health?
Yes, absolutely. So if we think of exercise, I'm going to actually connect it to metabolism and then
Yeah,
hormones, and I
please
think
do.
that sort of
Yeah,
helps.
yeah, yeah, yeah.
So exercise is so important just in terms of metabolic health, and as I mentioned earlier, your muscles being one of your most glucose hungry sort of cells. So an active muscle is actually excellent at burning glucose and improving insulin sensitivity. And ultimately, if we're improving insulin sensitivity, our hormone balance is, our hormones are much better in sync because they rely on that glucose metabolism to be functioning properly. But when we think about exercise, it's about striking a balance, isn't it? So quite often people will say, oh, but worry, they get worried about burnout with exercise. And actually it's difficult because, really, what is burnout? When we're exercising, we need our blood pressure to go up, we need our pulse rate to go up, and sometimes you do need to be out of breath. Actually achieving something called your VO2 max, where you're exercising at your maximum oxygen capacity, is actually good for us.
Mhm.
But equally, if it's causing us sort of immense amounts of stress and pushing up our cortisol, it's going to poorly impact our hormones. So one of the things I think about with exercise and hormones, and this is something that I often talk to young girls, teens about when we're talking about just trying to get that balance right as their periods are sometimes a bit irregular at the start, is actually learning to exercise with your hormones. So
Mhm.
progesterone, and that very calming hormone,
Yep.
it works on the calming receptors in our brain, actually. So it's really important to nurture. So that might be that's the sort of end part of your cycle. So maybe about a week or two, a week to 10 days before
Yep.
your period. That might be the time to think about calming down with the exercise, maybe doing, don't exercise daily, or avoid HIIT, or avoid anything too strenuous, and maybe think more around Pilates or yoga, walking, swimming, just things where you feel that it supports the calmness. And actually, estrogen, which is a very, very forgiving hormone, and actually allows for you to sort of push your body, which is the first part of your cycle. So from the first day of your period, is a really good time to sort of exercise a little bit hard, try to get yourself out of breath, try and push that pulse rate up.
Fantastic. Well, thank you so much for explaining that. And also touching on it for fertility, also too much exercise can negatively impact your fertility, can't it? So again, it's striking that balance between being healthy but not taking it too far.
Exactly. So when thinking about it from fertility, I think it's from a fertility perspective. I think actually, much like I advise sort of those younger teens because of the irregular periods and the trying to kind of, you want your ovulation to peak at a certain point. So that I do think that there's something to be said for changing up the exercise, changing what you do for
Yeah.
various points of your cycle. First half, go hard. Second half, less.
I love that advice. And then moving on to sleep, we've touched on this. I'm someone who's personally struggled with insomnia for different reasons during my life. And the more I feel it coming back, the more it stresses me out. And obviously,
Yeah,
again, you want sleep for hormonal balance, but also, especially when you're trying to conceive. And the stress of worrying that you might be suffering from insomnia makes it worse. So,
absolutely.
how do you help your clients with sleep patterns? And have you seen any shifts where you've had positive stories with clients you've worked with where it's improved?
Yes, so actually we look at sleep, and I think we have made, there's a couple of clients that we've helped, actually somebody who's very elderly that we made quite a significant sort of difference to, I think, just in terms of helping with sleep. And it's very hard, particularly as you get older, your sort of internal body clock, your sleep clock doesn't work as well as we
Right.
get older. So sometimes trying to fight that just actually makes the issue worse. So what we do is we try to optimize the other bits in order to optimize sleep, rather than trying to think about how do I sleep
Yes.
to to
Yes.
optimize the other
Yes,
bits.
exactly.
So, if I can go back to insulin resistance, melatonin is our sleep hormone. So, it doesn't actually send the body to sleep, but what it does is it signals the body, sends messages to the body. It's another hormone, so it sends messages to the body to switch the sleep processes on.
Right.
So it's what's supposed to get you to calm down and get ready to go to bed, but doesn't make you just fall asleep.
Mm-hmm.
And it's really closely connected to light. So we build our own melatonin store internally through exposure to daylight during the
Mm.
day. And there is a cap to it. So actually, early morning sunshine or morning sunshine is really, really good for building up that melatonin store. And then in the evening, as the sun goes down, melatonin gets released into your bloodstream. So if you've got a healthy amount, then you'll have a healthy amount in the bloodstream. Things that block that, cortisol.
Mm-hmm.
So again, it's really important. And what's shifted and changed for a lot of us is just changes in habits like working from home, emails, and phone messages, social media, and sort of being on it late. And if any of those sort of signal or trigger stress and cortisol, we will block that release of melatonin or reduce the release and impact of the melatonin.
Right.
Um, and then another thing is around the sort of our glucose metabolism. So, and how well we will then sleep and how we then metabolize the glucose the next day and our hormones is actually around insulin resistance. So there are studies and there's evidence that says after the sun has gone down, once the melatonin levels are high in our bloodstream, if glucose is also present in the bloodstream, actually we intensify insulin resistance. So we can exacerbate the problem.
Okay. Interesting.
But the reverse is if you have not got glucose, so you're fasting in that time,
Yep.
actually you really support your pancreas and you improve insulin sensitivity. So you work towards reversing the resistance. So when sort of often women will come to me, it's usually women, a few men have come to me, but the fasting rules are a bit different, and ask me about fasting. And I'm not a huge advocate of long fasting, and I think it's variable for different people as to what suits them. But one thing that I will often advise is that you can look at maybe sort of trying to eat your dinner, eat your main meal before the sun sets. A little bit harder in winter, but
Yeah. Yeah.
before the sun sets.
That's very good advice. Interesting. And actually, got a question about supplements. Magnesium or supplements for sleep, do you ever recommend them? Because I took melatonin when I was going through my IVF previous cycle.
Yes, so actually, and this is where I work with Kat, our nutritional therapist. So, and one of her sort of expertise and one of the things she contributes to the health plans is supplements and sort of what would be beneficial to people. But something that we often advise, we usually test magnesium levels as well, but we often advise magnesium for sleep to be taken. Yeah, magnesium
And
glycinate.
to know, good to know. And then, of course, gut health, which we
Mm.
know is important for every life stage, but
Yes.
especially for fertility too. So, tell us a little bit about how that can impact your hormones and, yeah, everything we've been discussing today, really.
Yes, I mean, I feel like it's a whole other subject.
Yeah, I'm sure.
Gut
I'm
health
sure.
is huge.
Yeah,
It in itself, when you think of the gut and the gut microbiome, it's like a whole body of its own in there,
yeah,
a whole world that of interactions that are going on, and really sort of underappreciated as a system. But what we're knowing and getting to know with advancing technology, and there's sort of advancements in testing that can be done to explore the gut health, is it is hugely connected to your mind, your brain health, your hormone health, and your metabolic health. I mean, for one, when we think of the weight loss injections and some of the receptors that those are working on, those that is impacting sort of your gut health as well, or your gut health influences that. But when it comes to hormones, it's I mean, I don't even really know where to start,
yes,
other than
yes.
to say quite often when I guess what I would say is when we look at root causes of issues, we often find the gut at some point has had a little bit of a hard time.
Yeah, I'm sure. I'm sure. And finally, two or three pointers that you would give to people who want to learn more and improve their metabolic health.
Um, I mean, our three tips are actually you mentioned, I felt like you mentioned them earlier, but it's the three tips that I say to
Yeah.
everyone. The first one is prioritizing your health. I think it's just it's difficult. I think when you're very busy
Yeah.
and if you've got families that you're looking after, if you've got relatives that are elderly that you're looking after, it's if you're juggling a job at the same time, high pressure job, working all hours, it's very difficult. But prioritizing your health is the first step, and then setting that goal, setting goals for what you want to achieve with your health. I think then it's about understanding your baseline. So before you're understanding where you're at now, it's what are your biomarkers? So we really work with those, with your blood tests, your blood pressure. It's really important to know what your baseline is so that if there are subtle changes, you can pick those up early. We don't want to wait for there to be a really major problem, a diagnosis like diabetes.
Yeah,
There's,
absolutely.
10 years before that can things can be picked up and changes can be made, prevention.
Yeah.
And then the third thing is just I I'm part of something called the British Society of Lifestyle Medicine, and they have a slogan that I really like to use, which is #OneChange. And it basically means sort of look at, for example, those six key pillars of your life and have a think about whether you feel that everything, if there are a few things that are off kilter or
Mhm.
that you could
Mhm.
improve, pick one and focus on changing it. And once it's become a habit and you don't have to think about it anymore, then you move on to the next one. And it's a good way of sort of changing your habits for the better, for the long term.
Love that advice. It's brilliant. Thank you so much, Dr. Shiv. And for
Pleasure.
anyone who is looking for a personalized, health plan, and wants some answers or wants to just take control of the situation, I urge you to get in touch with Dr. Shiv and the team at the U Clinic for a personalized approach. And this is linked up in our bio. So please head there to find out more, and really appreciate your time today. I've learned a lot
Thank
myself.
you. Thank you so much
And
for having me.
we can't wait to hear more about the new clinic launch in the next month as well. Very
Thank you.
exciting. And yeah, thank you for your expertise today.
Pleasure. Thank you very much. Wish you all
Bye-bye.
the best.
Bye-bye.
Bye.
Bye.